According to the most recent U.S. Census, more than 2.2 million people are incarcerated in the United States at any given time. Of those, it is estimated that 45% of federal prisoners, 56% of state prisoners, and 64% of those in local jails suffer from some sort of mental illness. Colorado correctional facilities currently house more than 20,000 inmates. The state has 71 jails, 20 state-run prisons, 5 private prisons, and 6 federally affiliated facilities. The Colorado Department of Corrections estimated that in 2016 that 39% of inmates within these facilities had moderate to severe mental health need. Mental illness is an alteration of thought, mood, or behavior that interferes with some aspect of social functioning. Prevalence of mental illness in inmates is up to 3 times higher than among the general public, and individuals with mental illness are 5 times more likely to be incarcerated during their lifetimes.
That correctional facilities in general are designed from a physical plant layout perspective, essentially the same way they have been for 200 years. Hospitals use a very different architectural design and layout and structure, and psych hospitals in particular have progressed to be even more considerate of space considerations, noise considerations, and a layout that looks a lot less punitive. And I would argue that if we really want to address the needs of individuals with a mental health condition who are incarcerated, we should either transfer those seriously ill individuals to a psychiatric hospital, or you could replicate what a psychiatric hospital looks like and does.
In the 1960s, JFK proposed an act that transitioned away from the tradition of institutionalizing the mentally ill in asylums. Consequently, eliminating the asylums of the past without adequate facilities or funding in place for the newly displaced patients led to an unexpected burden on correctional facilities. Thus, as asylum rates dropped, correctional populations steadily increased.
If we have an inadequate clinical care system, we can use the correctional system to manage that person. So what we're trying to do is recognizing when someone has a condition that's a mental health condition that's predominantly responsible for the behaviors they're exhibiting, and using police discretion and logic to say this person really needs help, clinical help. If an area can't find a designated facility to hold a civil committee, person on a mental health hold, jails can be used.
While one can biologically be predisposed to mental illness, it can also stem from one's environment, like from personal traumas. Mental illness resulting from trauma can easily be triggered or worsen because the individual may likely be existing in a state of flight, fight, or freeze, which can often be perceived as socially unacceptable due to their violent, unlawful, or generally taboo nature. Traumas that spur mental illnesses vary from each individual, but could be physical assaults, mental abuse, history of homelessness, or long-term exposure to high stress or dangerous environments. Previous traumas, such as sexual or physical abuse, most commonly result in victims having strong reactions to triggers that remind them of their ordeal. A trigger is an internal or external experience that is a reminder of one or more traumatic events. Various events and routines that occur day to day in correctional facilities, like banging doors, shouting, unfamiliar people, strip searches, cell extractions, and segregation, all of which may seem harmless to an onlooker, can easily be triggers to inmates with histories of trauma. These events often make it very difficult for the inmate's nervous system to reset itself. Therefore, inmates often live day to day in a heightened state of stress, resulting in an increased likelihood of aggressive outbursts or defiance. These actions are often met with more triggers like restraints or being assigned to solitary by uninformed staff, which perpetuate the cycle of trauma. In order to reduce this revisiting of trauma and improve the overall environment of both inmates and employees within the Colorado system, various new methods are available for implementation. For instance, from a training standpoint, correctional facility employees can be educated in trauma-informed care. Experts recommend that all institutions, including correctional facilities, be trauma-informed and adopt universal precautions when working with previously traumatized individuals. Universal precautions means that staff assume a trauma history is present in all individuals that they interact with, and thus, they would interact with them in a trauma-informed manner. This approach lessens the pressure on the guards and employees to determine whether a prisoner has had a traumatic past, and instead allows them simply to do their jobs and reduce harm simultaneously. A number of correctional facilities nationwide have made efforts to increase the use of trauma-based services. However, Fewer efforts have focused on implementing universal precautions or building a more integrated, multidimensional, trauma-informed culture in correctional facilities to both meet the goals of the corrections and maximize the success of trauma-based interventions. From a legislative standpoint, Colorado has pioneered many programs and initiatives to reduce harm to mentally ill individuals within the correctional system. According to a 2017 Colorado Legislative Council staff briefing, two trends have emerged. First, there's a focus on diverting persons with mental illnesses from jails and prisons to treatment programs. The second is to provide wraparound services, especially housing assistance and continuing medical treatment to inmates who are mentally ill and are re-entering society. Overall, when debating adjustments to Colorado's correctional framework to better accommodate those with mental illness, it is important to remember that there are two sides to every coin. Prisons are not a place for innocent victims. Oftentimes they house violent and dangerous offenders. The safety of staff must be balanced with prisoners' well-being. Force is a classic tool within the system and not something that can easily be removed from the facilities. Sometimes force is the only option for containment of dangerous people who pose a threat to not only themselves, but guards and the other prisoners. Yet, awareness that comes from the trauma-informed model may help to diffuse daily tensions and reduce the escalation of violence. Conversely, even the most dangerous inmate is a human with a history, and past traumas may be a reason for their erratic behavior. Correctional facilities exist as a way to contain people who pose a threat to society and a way to make criminals pay for their crimes. However, experiences while incarcerated can be the deciding factor in whether they return to society as rehabilitated or as further traumatized and more dangerous. By reducing additional trauma, triggers, and aggression within the correctional facilities, there is an opportunity to create a less harmful and more efficient system, focused on the proper containment, rehabilitation, and reintegration of inmates into society.